This session is the second part of our mindful movement series, and today we're going to be specifically focusing on back care. I know that lower back pain can be an issue for a lot of people. It's an issue for myself and something that I have to be very mindful of. And I also notice that when I don't do these type of exercises, how much or how different it feels in my lower back. Now, lower back pain can be caused by a multitude of different reasons, so it goes without saying that if it's something that you have been suffering with, it's definitely always recommended to check out with a physiotherapist or some type of physical therapist, just to make sure that there's nothing super significant that could be causing more damage and leaving it unchecked. So I always highly recommend getting it checked out by a doctor, or I would always go to a physio because they generally are a little bit better, or chiropractor. Having said that, common issues for back pain can be due to lack of mobility in other areas of the body. We are a kinetic chain, meaning everything is interconnected. So sometimes it can be something that's off in the knee, the ankle, that can then cause imbalances in the hip, that then leads on to causing back pain. It can also be a lack of connection or activation with the abdominals and the core specifically, meaning that your back is then having to overcompensate because the core isn't firing up. And that's where we really bring into this mindful movement. So it's taking influence from Pilates in this case, because we have to have that connection with our core. And some of the movements that I'm going to be sharing in this, you might think, oh, it's not really doing much. It might be that you aren't getting that core connection and that activation going on, because when you do, you should start to notice and feel the difference. So with that all being said, we're going to get into it. So we're going to start down onto the back. We're just going to start waking up through the hips. I know specifically for so I'm just doing like a figure of 8 with the knees, allowing the back to rock from side to side. A lot of my lower back pain has been from ever since having kids. So that signifies, you know, we get this stretching of the abdominal and the core when we have babies. Knees together now and just circle round. And so it's having to switch that back on, finding that connection again. I also have pain caused by ankle injuries. Like I say, it leads up the kinetic chain, change direction into the back. So it just wants to feel like we're just massaging the back down in towards the floor. And I do these a lot during sessions, but that's because it feels so nice. So from here, we're going to take one leg in, so interlock the hands on top of the knee and just stretch the other leg out in front, and we're just going to take a rock from side to side. From here, I'm now going to start to activate the core. So I'm lifting the head, pressing the lower back down into the floor. Inhale. As we exhale, we're just going to change sides, taking the head back down. Repeat onto the other side. Wiggle that knee around so that we're just opening out into the hip. Bring in, and we're just going to do the exchange. So exhale, hold. Keeping the lower back pressed down into the floor. Long legs, point the toes. Just bringing and tucking that knee in as far as we can. We've got 4 and 3 and 2 and last one. Release it down. Take the feet down to the floor. I just want you to take the arms out to the side. So from here, we're just going to let the knees flop over side to side, and the hips can lift one side then the other. Again, just being nice and fluid with this movement. And then we're going to come back to neutral. Now I might just stand up to just show you this. What we're going to do is a pelvic tilt. From here, all I'm doing is tilting the pelvis so that I push the lower back into the floor and then release it. So again, this might look like it's nothing. Stay down on the floor. So all I'm doing effectively is going from being the slightly arched position to pushing the lower back into the floor. Now when we're doing this with the feet on the floor, so just go through these. Inhale, prepare. Exhale. Press the back into the floor and just go with that full breath. Inhale, release. exhale. So as I talked about at the beginning, we want to have that connection, mentally connecting with what our body's doing and where our muscles are activating. Now what tends to happen with this is that you'll push your feet into the floor. It's not a hip lift. I'm not lifting the hips. All I'm doing is tilting the pelvis, and I want to be as light as possible with my feet. So I'm hardly using them. We can make this even harder by doing with feet off the floor. So the back's almost lifted off the floor. Inhale, prepare, exhale. Push those lower abdominals into the floor. This is actually quite challenging, and as I get to this lifted position, I can feel that in my back, so I prefer to do it with my feet on the floor, but I'm just concentrating on being as very light on those feet as possible. So it's this lower abdominis, the transverse abdominis, the band of muscle that runs across the lower abdominal wall. And we're just going to repeat those. Really working with the breathing. So when we think about transverse abdominis, we think about almost a corset around the lower abdominal area. We're just going to do one more of those. And then with these, bringing the feet up into a tabletop position. And from here, we want to get that connection. So now it's that back into the floor like we've just been practicing, but we want it to stay there this time. Inhale to prepare, and exhale, slowly drop the knee down to the floor. And inhale, coming up. Really starting to feel a little bit higher up on the abdominals now. Rectus abdominals starting to bring into this work. It's very slow and controlled. We do not want to be holding our breath. We do not want to let the back lift off the floor. And for the purpose of this video, I'm just going to keep it fairly short. We're just going to walk through a variety of different exercises, and that could be enough. You could always come back to the beginning of the set and do it again. If you do suffer with back pain, just doing this once per day, a few minutes per day, just to switch on that core is really going to help to gain some deeper core strength and help to support the back. Last one on each side. And bring the knees into the chest, just rocking from side to side. Good. From here, we're going to bring the tiptoes down to the floor, arms out to the side. So I want on this one to keep the knees level. Taking a breath in to prepare, drawing in your belly button, exhale, coming over to the side. Inhale, coming up. So again, easier if we weren't having a mindful connection. I could just let the legs flop, the knees would split, but I want to keep the knees together. We're controlling the movement through the core and now coming into the obliques. So the obliques are the muscles down the side of the waistline. Breathe out on the way over. Inhale, coming back up to center. If you wanted to make this harder and as you start to progress and start feeling stronger, we can do it with the feet off the floor. So we want to avoid bringing the knees in, but keeping at this right angle position. Inhale, prepare, exhale. Keeping those knees in line, really slow and controlled. We don't have to rush. This is just a few moments of the day where you get to connect with your body. It's like self-empowerment. We are strengthening our core because when the core is strong, it helps prevent pain, prevents injury, but it also helps us get the very most out of each exercise we do, even when we're doing our main body of movement. And back up to center. Bring the knees in, always releasing it out because it definitely feels nice. From here, Just going to roll over onto the side. You're going to push yourself up, and we're going to come up onto hands and knees. Now we're going to be doing spinal flexion, but it's not like a cat stretch like we would normally do. What we're going to be doing is basically the same as what we did when we were lying on the floor. So it's inhale, prepare, exhale, tilt the pelvis and draw your pelvic floor upwards and inwards. And inhale, release. I'm not overarching, because if you're anything like me after kids, this lordotic, this overextension of the spine can increase and make back pain that little bit worse. So again, transverse abdominis, lower abdominals are being activated. Think about using your core to initiate the movement. As you exhale, you're pulling your belly button upwards and inwards, as you are with your pelvic floor muscles also. We're going to do 4 more. I also think it's just quite, you know, we always want these like big solid workouts and movements, but it's these fine movements that can really make us stronger and really get to the points that we need to be. I think that was 4, but I've lost count. From here, we're going to do a bird dog. So easier is to, we'll start easier and then we'll build it up. So we're going to inhale, prepare, and then as we exhale, we're taking the arm out above the head, thumb to ceiling, inhale back down, and we're just going to alternate it. So whilst we're doing this, what we're focusing on is that breath out, engaging pelvic floor, pulling belly button upwards and inwards. Now, imagine that you have a glass of water in between your shoulder blades. So we don't want to be lifting like from one side to the other. We want to keep it really stable. We're keeping that back flat and just slightly engaged through there. 1 more on each side. So we're going to do the same movement pattern, but with the legs this time. This time the glass of water is placed on your lower back and we're trying to keep it still and stable. So inhale, prepare, exhale, kick the leg back. Inhale, come back down. Now what tends to happen is that we want to lift the hip and we want to rock from side to side. So focus on having that core pulled in, always. And the other thing that can happen is that we lift the leg too high and the back arches. We want to keep that pushed up position, or when we were laying on the mat, the back pushed down into the floor. And what will happen is as you start to really connect with the movement and sustain that movement pattern, remaining still, you should feel that back having to work, not the back, but the core, those abdominals, those deep internal muscles and connective tissues. We can speak. And then what we can do is add these together so it goes opposite arm to leg. Keeping that back stabilized, don't let it arch. Drawing navel to spine. Keep working with the breath. Activating pelvic floor. Nice and controlled and slow. How's that glass of water doing? One more on each side. And release, sit back. Take the arms over to one side. And then to the other side. And we're just going to come all the way down into that child's pose. If you're able to, so take the knees a little bit wider. If it feels okay, you can either just sit here with the head onto the hands, or we can come all the way around, and we're just going to hold for a few deep breaths. Breathe all the way down and visualize that breath going all the way down the body and into the spine, and releasing and letting go of tension. Just have that vision of how much stronger just doing those few simple exercises has helped it to be. You're reconnecting with your body, you're listening to the signals that it's been sending you, and we're honouring that. And know that we're rebuilding, it's time to restructure, time to come back to feeling strong in a way that's supportive. Release, take the hands to the floor, slowly, bring it up, coming around into a seated position, sit tall, and we're just going to take the hand up, one hand onto the floor, reach across the top, lengthen into your fingertips. Slowly, as you breathe out more, feel the tensions let go. Inhale, bring it up. Exhale. Over to the side. And it's, you kind of like want to sink in, like let the arm bend, let the shoulders shrug. Keep that intention, open out the chest. Keep reaching up into the fingertips. Breathe fully and deeply. And often for aches and pains, one of the best things that we can do is just allow ourselves to breathe into it. That in itself brings so much healing to the body when we just slow things down and move with intention. So I'm just going to take the hands out in front. You might feel that this is enough of a stretch. If you want to take it a little bit further, we're just going to fold it forwards. Back up, this time bringing the feet out in front, so we're in a diamond position. It's not a boat where the feet are close to the body, they want to be angled away, and same thing, just come forwards. You can hook onto the feet wherever feels comfortable for you. Lead with the chest first. As we exhale, go down, and then release it out. And that brings us to the end of our back care series. I hope you enjoyed that, and I hope you will just give yourself that practice. If you just start to do it daily, I guarantee you'll start to feel so much stronger and start to relieve some of the aches and pains and niggles that you may have been experiencing in your lower back. Never push through pain. Just be very aware how it feels for you and your body and adjust accordingly.